Well, for many years, surgery was the only treatment for cases of colorectal cancer, but now there is a new treatment that's offering some newfound hope. Marty Salt is putting her family first tonight and spoke with a patient who went through this new treatment.
When Patty Gehring went in for what she thought was a routine colonoscopy, her world stopped.
Right after I woke up from the colonoscopy, they said it was cancer.
Doctors confirmed it was stage 3 colorectal cancer. Her first thoughts were of her husband and 2 sons, Henry and Matthew.
The first thing that started going through my mind was like, am I going to see my grandkids one day? Or, am I going to see them graduate from high school or graduate from college?
Traditionally, treatment meant surgery, often leaving patients with a colostomy bag for life. But Patty's doctors at the University of Cincinnati Cancer Center offered a different path.
She was one of our first patients here that we tried this strategy for.
Instead of surgery, Patty underwent radiation and chemo for 6 weeks, 5 days a week, followed by 4 more long months of chemo.
And when I went into the doctor's appointment, he said, the cancer's gone.
Now, this watch and wait strategy for colorectal cancer is changing care nationwide.
Maybe even 5 years ago, all of those patients would have gotten a surgery because that's the location that the tumor started.
Today, Patty remains cancer-free and focused on her family's future.
Watching my sons turn into adults and start their lives and just, staying around for all the milestones in their lives.
Marty Salt, WGEM News.